My name is Sidney Glasofer. I work at Associates in Cardiovascular Disease. For them, I see patients in the office as well as in the hospital on new consultations and follow-up visits. I also do standard echocardiograms, transesophageal echocardiograms, nuclear stress testing, whether or not it's pharmacologic or exercise. I also do interpret cardiac CTs as well as some vascular studies. Well, I think that preventive cardiology is something that people need, not patients. The idea is to get to people and adjust their risk factors before they become patients. Most people think they need a cardiologist after they've had a heart attack or heart failure or some sort of arrhythmia or heart problem. What we like to do is focus on treating the patient before any of that happens. I think the biggest risk factor that obviously everyone knows about is smoking and weight loss and exercise. But beyond that, a lot of people just think they have good cholesterol and don't know that there are actually many different types of cholesterol. There are also certain laboratory tests now that we can do, such as a new test called CRP, or C-reactive protein, which can be used to help us figure out what your risk factor is for a future cardiac event. These are also helpful in that they can be modified with medications that we can prescribe, such as statins. There are many studies now which link vitamin D deficiency with cardiovascular health. We know that vitamin D deficiency is actually more prevalent than one would expect, or that many of us have expected. And this is linked to the fact that people are staying out of the sun more often and using sunblock when they are in the sun. Vitamin D levels can be supplemented very easily with over-the-counter medications and is actually very important for cardiovascular health.